talking to one table at a time, not looking at a whole lot of people. So you'll have to bear with me. You may have to see the top of my head a lot while I try to look at my notes. I grew up in the restaurant business, been in it since I was 2 years old. My dad had a steakhouse, and back when he was doing that, we took 40–45% to the bottom line on a regular basis. I had my first restaurant by the time I was 18. Again, I still took 40–50% to the bottom line at that time. In those days, we were looking at 10 and 12% payroll, not 30–35. We were looking at a food cost of 12–15%, not 30–35%. What we can't take is more things that we had to pay higher prices for. Nowadays, for a restaurant business, if you can take 2 or 5% to the bottom line, you've done very, very well. That's just because of all the price increases, and things just cost a whole lot more now than what they used to. At Beth Marie's, we do offer not really a health insurance policy, but we do give a $300 allowance for health for our general managers. At Ruby's and Beth Marie's, we have offered to help them with health insurance, but they've opted for higher pay instead. We always let the employees vote for what they'd rather have, and they've always stuck with rather have higher pay. And I don't believe even my general managers have bothered to get health insurance. They just rather take the $300 cash and run with it. At Ruby's Diner, I employ 18 employees. 10 of those are full-time. At Beth Marie's, we now have 45 employees. 16 of those are full-time. Hopefully, Beth Marie's, we're looking at growing. We're hoping to be able to afford to do so. My payroll is at Ruby's roughly $146,000 a year. At Beth Marie's, we're looking at $320,000 a year in payroll. If we had to do furnished health insurance, if it was mandated upon us, we would not be able to afford to do so. We've looked at the cost, $2,400 to $3,600 per employee a year to have a health insurance policy. The 8% mandate would actually end up being cheaper on us at nearly $11,000 a year. In the restaurant business, where you count how many packets of sweet and low you use every day, how many boxes of straws you've gone through, and you teach the importance to the employees of how much a napkin costs, having to put up an extra $11,000 for that's not even budgeted would really hurt. Our payroll tax now is close to 22% already, and so another 8% would take us to 30%. It's really hard to justify how we would come up with that kind of money. Most of the employees that I've had over the last 30 years work a minimum of 2 jobs, 2 full-time jobs. I've even had employees that had 3 full-time jobs that they carried out. I would be concerned about if all 3 employers or both employers had to also pay for the same health care for the same individual who's working full-time at all these different jobs. Restaurants do employ a large number of people. Most of your big chains have 50 to 100 people in a location. Anyway, I find it very difficult to, I work a lot of hours. I put in a lot of hours. I don't make much per hour. If you was to break it down, look at that. I do it because I like it. I enjoy it. It's a business I've grown up with. It would make it hard for entrepreneurs to get into business knowing that they would never be able to succeed or be able to grow. And that would help hurt job opportunities as well as in the future. We'd like to open up 5 or 6 more Beth Marie's. If we can't afford to, then that also cuts down on job opportunities.